Newsday continues here on One News Now. I'm Charles Lejano. We have some breaking news. The IATF suspends its protocol of shortened quarantine periods for fully vaccinated close contacts of COVID-19 patients. Recall that under a July 2 resolution, fully vaccinated individuals may undergo a shortened 7-day quarantine period, provided that they remain asymptomatic for the duration of the said time frame. With this suspension, all close contacts of probable and confirmed COVID-19 cases shall be placed under a mandatory quarantine period of 14 days. Metro Manila LGUs are now starting to distribute cash aid or ayuda to residents affected by the lockdown. To give us the latest on the ground, we have JC Cosico now joining us live from Parañaque. Good morning, JC. Do you have for us?
Charles, Parañaque City has begun the payout of the ECQ ayuda to eligible residents today. Now the city received a 5.6 million cash aid budget from the national government. Around 139 million households are expected to receive cash aid here in Parañaque. Low-income residents are expected to receive 1,000 pesos up to 4,000 pesos per family during the enhanced community quarantine. The Interior Department says LGUs are given 15 days to distribute the financial assistance, but this may be extended upon the request of the LGU. LGUs are also mandated to create their own grievance and appeals committees to address concerns related to ECQ ayuda distribution. The government also has the power to suspend payout if health protocols are not followed during the distribution. Here at the Green Heights Village in Barangay San Isidro, around 800 families are expected to receive the cash aid today. Parañaque targets to finish the payout within 2 weeks. And those who won't be able to receive cash aid will still receive food packs from the LGU. Charles, cash aid distributions in other Parañaque barangays and other NCR cities are also ongoing today, while the city is set to receive 48 billion pesos for the ECQ ayuda. Back to you.
Thank you for those updates. That was JC Cosico reporting live from Parañaque. The health department said 175,000 oxygen tanks are needed should there be a major Delta variant-driven surge. On 1PH sa totoo lang, DOH spokesperson Maria Rosario Vergeire said 86% of oxygen tanks produced by manufacturers from all over the country were enough for the regular needs of hospitals back in March and April. But because of the Delta variant, Vergeire estimates that hospitals may need twice as much as the earlier supply. She warns that the projection may also increase as the number of patients rise.
Nakita ho natin na nasa mga 150 to 160 tanks ang na-generate po in a day. So meron ho tayong gap na around 10 to 20. Pero syempre, yan po ay isang rough estimate or isang analysis na alam natin na magbabago yan. No? As cases increase, as hospitals get a lot of admissions, maaari pa ho magbago. Kaya nilalagyan ho natin ng buffer yan.
With authorities banning outdoor exercises in the metro during ECQ, how exactly can citizens stay in shape? Camille Samonte reports.
Some residents are still doing their exercises outside the subdivision in Quezon City. This is even after MMDA Chairman Benhur Abalos announced yesterday that outdoor exercises are now prohibited during the 2-week ECQ in Metro Manila.
Huwag muna sanang lumabas ng bahay sa umaga dahil nga para mag-exercise, dahil nga number 1, tumataas ang kaso natin. Number 2, halos yung ating nasabi nga sa ICU medyo critical na.
One of the joggers, Eloisa, said she didn't know that the policy has already taken effect. Eloisa explained that she still prefers to work out outside due to limited space at home.
Siyempre, kailangan na exercise din, proper breathing, tsaka yung activity talaga outside. Kasi sa bahay, limited lang talaga eh. Hindi ka makatakbo.
Adrian, on the other hand, said he will just comply for everyone's safety.
Pero nung medyo lumuwag po, tinake na namin yung opportunity makapag-jogging na rin sa labas. Pero po ngayon, edi siguro po balik na lang uli kami sa home workout.
According to a fitness coach, there are still exercises that you can do at home to stay fit and healthy. It is also advisable to join online workouts that are easy to follow.
More on bodyweight workout lang siya, like push-up, plank, lunges, jumping jacks, squats. Tapos pwede rin sa mga bottled water like kung wala silang dumbbell sa bahay like side lateral raise, front raise, shoulder press.
These bodyweight exercises can be done even without gym equipment.
For example, ito pa yung bottled water. Pwede pong 1 liter. Lagyan nyo lang po ng tubig. Gawin po natin for shoulder. Side lateral raises. This is 1. Okay.
And if you have a bigger space at home, jump rope exercises are good alternatives for cardio workout. Fitness experts also encourage the public to maintain your workout routine even on lockdown because this is one of the best ways to strengthen the immune system.
Hindi lang naman COVID ang sakit sa buong mundo eh. So ngayon pag ikaw naging sedentary yung lifestyle mo, pwede kang mapabilang doon sa number 1 leading cause of death na mga binanggit ko. So paano mapiprevent yun? Through regular and proper exercise.
For News 5, Camille Samonte, we are One News.
The Health Department is recommending several remedies to alleviate mental stress brought about by the pandemic. This as the department's crisis hotline saw a significant rise in calls received, especially from adolescents. Greg Gregorio with the story.
Engineer James Wong has been a professor for 6 years. Professors from various academic institutions were forced to shift to a virtual setup due to the COVID-19 pandemic. For him, the online setup made it twice as hard to teach, especially engineering courses.
Mahirap. Especially, limbawa sa engineering, computation. So this is not anymore the usual whiteboard.
Engineer Wong admitted that this stress has aggravated his mental health issues. He says he made it a point to balance his work and life and eventually sought professional help.
Mahirap kapag nandun tayo sa point na in denial kasi hindi nagagamot o hindi na iaayos yung dapat ayusin.
Like Engineer Wong, more individuals are experiencing mental health issues amid the pandemic, according to the health department.
The tendency is that hindi mo na alam, hindi ka psychologically prepared, no? Nawawala yung boundaries ng yung line between working and yung personal life mo.
With this, the crisis hotline of the National Center for Mental Health has seen a 4-fold increase in calls received, including from adolescents.
What's alarming yung mga younger ones, no, the medyo mga bata calling, no, na they wanted to talk to someone, no, in the for mental health consultations or services.
The agency recommends various self-care measures, such as taking care of one's body, assessing stress or anxiety triggers, finding hobbies that will relieve stress, and talking to people you're comfortable with. If these non-pharmaceutical interventions are not enough, seek professional help through the NCMH's crisis hotline. The DOH said it is also looking into a study in Europe about patients manifesting neuropsychiatric symptoms 6 months after recovering from COVID-19.
Ang sinasabi niya, some of them really have depression, some of them are yung brain fog na tinatawag, some of them are they're not really functioning the same way before they had COVID.
For News 5, Greg Gregorio, we are One News.
An expert says Delta variant symptoms show no consistent patterns yet. On One News is the Chiefs, pediatric infectious disease expert Dr. Anna Ong Lim said there's no definite data yet whether the Delta variant has symptoms different from those previously reported for COVID-19 cases. There are reports saying that those infected with the new variant only experienced symptoms similar to the common cold. She also explained that some Delta variant patients, including children, may not have fever but could experience other symptoms such as loss of taste. Others, on the other hand, may experience fever but not the other symptoms. Ong Lim said the best option is still to get tested, especially if the patient had close contact with a COVID-19 positive case.
Kung meron ka ng typical symptoms accompanied by fever, definitely magpapatest ka. Tapos kung wala ka man fever pero may respiratory symptoms, lalo na on the background of an allergy, then I guess the best thing you can do is pakiramdaman. No? Do you think this is typical of your usual symptoms? And then try to think back, na-expose kaya ako? Kasi kung yung constellation na yun mapagsama mo, parang iba ang nararamdaman ko and na-expose ako, syempre better idea, magpa-test na lang.
Pediatric Infectious Disease Society President Dr. Marian Bunti tells Radyo 5's Ted Filon that Delta variant symptoms among children and adults are almost the same. She also said that children can also be prone to fever and other symptoms due to other illnesses such as dengue. The experts said that getting tested is still the best way to verify whether one is COVID-19 positive or not. But she noted that using antigen test kits at home may not be the best option.
Ang antigen test po kasi hindi naman ho kasing sensitive ng RT-PCR. Ngayon, kailangan maayos din ang pagkagawa niyan. So kung hindi maayos yung pag-test niyan, pwede tayong magkaroon ng
mali.
false negative na resulta. But it doesn't rule out na na COVID to or dengue to or whatever. Kaya mas maganda pa rin po na dadalhin sa doktor at yung doktor po ang magre-request ng test kung saan maayos na pasilidad.
Here's a quick look at some of today's headlines. 11 areas in Cebu are now under modified enhanced community quarantine due to the surge in COVID-19 infections. Manila Mayor Isko Moreno shrugs off President Duterte's recent tirades and calls it political drama. And Errol Spence Jr. withdraws from his fight against People's Champ Manny Pacquiao due to an eye injury. And those are the top stories at this hour. Join us again later at 12 noon as we continue to monitor the day's biggest stories. You can also catch One News on Signal Play. Just register for a free account at www.signalplay.com so you can stream One News live anytime and anywhere. I'm Charles Lejano. Mask on, wash hands, and stay safe, Philippines. We are One News.